are the commonest cause of jaundice. Hepatitis A generally affects the children. No vaccine available for hepatitis E. Hi, I am Dr. 𝗃𝗃𝗿𝗄𝗏, Senior Consultant Gastroenterologist and Hepatologist at Zen Multispeciality Hospital Chembur. Also Professor and Head of Department of Gastroenterology at 𝗃𝗰𝗿𝗄𝗏 Medical College, Sion. Today, I will be speaking to you about hepatitis A and hepatitis E. These two are the commonest cause of jaundice and the jaundice that we see very routinely. They are very common in the rainy season because of contamination of food and water supply. These two viruses enter our body through the oral cavity or through the mouth. Then they get infected in the intestines and then it gets localized in the liver, and that then causes inflammation or swelling of the liver and patients develop symptoms. So what are the symptoms commonly? Common symptoms are fever, which will last for a few days, body ache like any other viral infection. However, in addition to that, patients also complain of right-sided abdominal pain, nausea, vomiting. After a couple of days, patients will develop yellowish coloration of the urine and the eyes, commonly what we call as jaundice or 𝗃𝗃𝗍 in our local language. It's when this happens that the fever subsides in most of the cases. Normally, this type of hepatitis or jaundice can last for around 2 to 6 weeks. In majority of the patients, the jaundice is self-recovering and will recover within 2 to 4 weeks or 6 weeks at the most. Most of the patients don't require any specific treatment. So how do we treat? Well, we treat them with rest, avoid exertion, maintain increased glucose or carbohydrate intake, support the liver, and the liver will recover on its own. Both these viruses do not generally cause long-term complications except only in pregnant females. So how do we protect ourselves from hepatitis A and E? Well, if they are coming through the contaminated food and water, so make sure that we consume hygienic boiled filtered water. Our food materials, especially the raw foods, fruits and salads, are washed thoroughly. The food is cooked. Avoid stale food. Avoid eating food at unhygienic places. Hepatitis A generally affects the children. Hepatitis E can affect both children and adults. There is a vaccination available for hepatitis A, which is generally given, and we have to make sure that our child receives the vaccine in early childhood. It will protect it from this infection. There is no vaccine available for hepatitis E. As I said, it's a mild infection most of the cases, but maintaining proper hygiene of our food, hand hygiene is another important way, because fecal-oral, that is through improper hygiene, it can spread to the families and communities. So make sure that we maintain hygiene, make sure that our water and foods are sanitized well, and avoid eating at unhealthy places. Thank you. This video is for educational purposes only. If you develop any symptoms related to liver disease, please see your nearby or regular consultant at the earliest.